Okay, so let's begin with the session. So basically, we will be discussing about how to prepare for FRCS Glasgow Part 3 in particular. So, how does one reach to the Part 3 of FRCS Glasgow? So there are two routes. You can either go through the FRCS route, where you give FRCS Part 1. There is another route that you can go, that is through FICO. So FICO also you need to give, there are 3 stages in total for FICO. The first stage you give refraction and basic science. And then the second stage you give clinical. So after you've given your FICO clinical, you can go ahead with the third part of FRCS Glasgow directly. So I followed the FICO route because I think that is easier.
Okay, so I think we have lost Dr. Mehek. Dr. Aditi,
Net connection.
yeah.
Hello?
Yeah. So that's good to know. I think, so Mehek is there.
Is the
Mehek,
net connection?
yeah, but we cannot see your slides.
Oh, just a second. Can you see them now?
Yeah.
Am I audible? Yeah.
Yes.
Okay. So I think I was telling about the routes that you can go to the third part of FRCS. So as I've mentioned, FRCS 1 and 2 and then 3 can be given. Another route is FICO route. FICO route, you give FICO part 1, which is the basic science and refraction. The second part is the FICO clinical. So once you pass the FICO clinical, you can directly go for FRCS Glasgow part 3. So this is the pathway that I followed because I think it's easier. Plus, once you give FICO advanced, you also get an additional degree of FICO itself. And FICO also helps you in a lot of observership abroad as well. So I think this is an easier route, but that's a personal choice for a lot of people. Now, going to the basic structure of the exam. So the exam is a 2-day exam, and you will get 1 day gap between both of your exam. Going to the first day of the exam. Now, the first day of the exam, it is a structured oral exam. So on this day, they are trying to test your theoretical knowledge. Basically, how much knowledge of ophthalmology you have. Basically, what you learn during a post graduation, that is very, very important. And this day, that is particularly tested. So you have 3 stations on this day. Lid oculoplastic anterior segment is the first station, followed by posterior segment. Then you have neurology, motility, and general medicine. The series can vary. You can have any of them first or second. That depends on the particular candidate. So you have 3 stations. Per station, you have 2 examiners, and each examiner gets 10 minutes. So you have 20 minutes per station. 20 into 3 station, that means 60 minutes is the exam for 60 minutes is the exam on the first day. So the important thing here is when you go and sit there and give the exam, you will get two types of questions. One in the form of pictures, and second in the form of case scenarios. So it's first of all, it's very important to understand that what they're trying to test is whether you are a very safe ophthalmologist or not. They're not going to throw very rare cases. They're not going to throw you syndromes that you get confused with. They are going to give you majority of the cases would be what you see in your OPD day in and day out. So definitely there is no, we do not have to be stressed about it. And I think one major tip over here on this day is that when you get the case scenario, suppose I gave my exam in September this year, and when I got a case scenario, so a printed paper was given to me with a case scenario. Example was 30-year-old patient with corneal stromal edema. So when you get such a case scenario, I would request you not to directly go in for the diagnosis or tell the diagnosis. I would like you to, all the candidates, I would like they would like you to think in terms of differentials. And then you can ask the examiner leading questions in relation to the diagnosis that you are thinking. So I think when I was given this case scenario, I had asked him 2 to 3 questions again to him to come to a diagnosis. And that is what happens when you see a patient normally in your OPD as well. So I think I had asked him whether the patient had a history of recurrences. And to that, examiner said, yes, the patient did have history of recurrences. And therefore, I finally came to the diagnosis of herpetic or disciform keratitis. So I think that is more impressive rather than just giving the diagnosis directly, because they want you to think in terms of the spectrum of the diagnosis and not just give a diagnosis straight away. And pictures are straightforward. You'll get a picture and you'll have to, they'll question you according to the picture and the case. So on this day, you basically have to discuss the case like you normally do with a poly. And that is probably what will, pass you in this on this particular day. So, so there are certain targets that you have to achieve before your first day of your exam. And a lot of people ask that what is the duration of preparation that you need to undergo. That really varies. So you have to have certain targets in your mind. And whenever you can achieve the targets would be your duration. Some people do it for 6 months, some people do it for 3 months, some people also do it for 1 month. So that is regardless. You have to kind of achieve the targets. And some of the targets that I had fixed for myself was that, first of all, from Kansky, I did not read word to word because I think I did my post-graduation 3 years back. And from that time, I had not read Kansky word by word. Even for this exam, I did not. What I did was I went through Kansky's pictures. Only the pictures I had gone through, and whatever was written under the pictures I read, and around that, a little bit of theory, but not word to word, mostly pictures. And second thing that you need to read from Kansky is that so one important question that will be asked are the differential diagnosis of the particular diseases. And Kansky gives you the subheading of differential diagnosis, but it doesn't give you in all the diseases. So whatever you need to know are there in the subheading of differential diagnosis. So just go through Kansky, read the pictures, and wherever you see the subheading of differential diagnosis, see the disease and see the differential diagnosis of that particular disease. Because at the end, you will not remember the differential diagnosis of everything. That's very difficult. So stick to the differential diagnosis that has been given to in Kansky, and that will be more than enough for you. Second, the main book that I followed was the Ophthalmology Examination Review by Wong. This definitely I did read word by word, and this is the main book that you can follow, and it will be really helpful. So this is the main book. Plus, this is another book that is Guide to Viva and OSCE. This is a very small book, but I think this is an amazing book that they have written. So the questions in this book is that they'll give you a picture and they'll give you questions in relation to that picture, and they will give you answers in the way that you are supposed to answer it in FRCS, and they expect you to answer it. And I think this book was like is a game changer in this particular exam. This is an amazing book. Kansky is required. I think that would be enough for the first day of exam. And you will also be asked around medical emergency. So this is the book that you need to see. And in this, I think the second chapter is life-threatening emergencies. That would be more than enough for you to cover the medical emergency that you need to know as just. All right. Now going to the second day of the exam. Now the second day will be after a gap of a day. So you will get to prepare for that particular exam. On this day, you will be called to a hospital and it will be clinical examination. That means you will have to test your skills over live patients. On this day, you will have 4 stations: so anterior segment, posterior segment, neuro-ophthalmology and ocular motility, and oculoplastic and lid disorders. In each station, there will be 3 patients. When I gave recently in September, one of the station I examined 2 patients. Rest 3 stations I had examined all the 3 patients. So, but it doesn't matter. Even if you, I think even if you examine 2 patients, I think, and you give answers in a good way, I think you can pass definitely. But if you examine all the 3 patients, for sure you will pass. So on this day, what are the targets is that you need to first of all subscribe to Gayatri Ma'am's YouTube channel, which is one is pupillary exam. Am I audible?
Yeah, it's breaking in between, but please go ahead. Okay, I think we have lost connection with Dr. Mehak.
Sorry, my network is a little bit dicey, I think.
Yeah. Please.
Where that
Pupillary examination.
all right. It's visible, right?
Not yet.
So
Screen.
Gayatri ma'am has a channel, and she has 3 videos: pupillary examination, ptosis, and proptosis. So that is something that everyone has to see. These videos are what you need to know.
Yeah, we
So
can.
if these videos, I stumbled upon these videos just a day before my exam, and I think that was a game changer for me, because these videos she has given in such an amazing way. She has step by step given how we're supposed to approach the patient during the FRCS exam. And I think that nobody can do it better than her. Even if you read a lot of books, I think that won't be enough. But these videos, if you see, and then you examine the patient in the same way in your exam, I think definitely the passing rate would definitely be higher. And so basically in anterior segment and posterior segment, there is no series in examination. In posterior segment, you just have to examine your indirect and your 90D. Anterior segment is just a normal slit-lamp examination. But in neuro-ophthalmology and oculoplasty, you need to have a series of steps of examination that you cannot miss. And that is what her videos cover in a very, very perfect way. So you need to see these videos along with FRC's Cakewalk. Now, FRC's Cakewalk, I read only the first 2 chapters, and that was more than enough. So if you read FRC's Cakewalk, the first 2 chapters, and you follow what Gayatri ma'am says, and you have to keep practicing this on whoever there is one day before the exam or even before. So even if you have your friends around, you can practice on each other. So when you practice on each other, you will be clear with the steps. And once you're clear with the steps, you will be able to examine all the patients during a FRCS exam very well. Plus, just another tip would be use Meta AI for your FRCS preparation. So whenever you don't feel like, reading any book, go and use your WhatsApp and use your Meta AI. Tell him to ask you questions regarding FRCS, specifically I think the medical emergency part. I think I did that. I asked him to ask me medical emergency questions, what they would ask me in my FRCS ophthalmology, and Meta AI was able to ask me and give me amazing answers, specifically, because we don't read emergencies that much, and that would be a very, very faster way to prepare. At least the medical emergency would be really covered by just those questions through Meta AI, and I use Meta AI for almost all my exam preparation these days. So that would be more than enough, I think. And plus, the only thing that you need to remember is that if you are a postgraduate, then it's very important that your basics during post-graduation is very, very clear. So that will really help in FRCS, at least that helped me during my FRCS exam. Plus, plus if you see a lot of patients in your own clinic, that will help you in your FRCS exam a lot. On a regular basis, see a lot of patients, follow a particular protocol, and that would really help you in answering during your FRCS exam, and which will actually make you basically ace the exam. So that will be more than enough, I think. Yeah. Thank you very much.
Okay, thank you, Mike. That was really wonderful. So now we'll go to our next speaker, and congratulations, Aditi. And so Aditi is a pass out from Nair Medical College, and she's currently undergoing her VR fellowship at Shankar Nethralaya, Chennai. And we'll get to know more how Aditi cracked the code. So Aditi, please take over.
Yes, sir. So are you able to see my slides?
Not yet.
Just a minute, sir.
Yeah, we can see them.
With the slides?
We can see your screen now. Yeah.
Okay. Good evening, everyone. Can you hear clearly?
Yes.
Yeah. So I think some of my PowerPoint is going to be a repeat of what Mahek just said. So I'll just go through it quickly. If there's something extra, I'll just pause and give it some time. So I feel it is not a tough exam. I feel it is the stage of life at which you tough. So this, I think my post-MS, I've almost had a 2-year fellowship and one postgraduate bond. So it has almost been 3 years since the time I've actually studied hardcore. So that makes it a little bit tougher because you've lost touch with the other parts of ophthalmology, like ophthalmology, squint. I haven't for a long. So that made it a little bit tougher. So the gap between your MS and the exam, final exam that you give, if the lesser it is, I feel it better it is, because that will you will be fresh as soon as you those minimum 5-year requirement. So it is an easy exam, I would say, but it is easy to pass, but also equally easy to fail if you don't follow their, the typical methodology with which they want you to examine the patients and the way they want you to do their the clinical exams. So I would say it is an easy exam to pass, but also easy to fail. So it actually tests your presence of mind and your ability to handle acute stress, because there is literally no time to think. It is something that has to be there at the tip of your tongue for you to give the correct answers at the right time when they ask you. You have much time to examine the patients as well. So you have to be really quick on your toes during those stations and doing the OSCE vivas. I feel the examination philosophy is they are basically testing you whether are you a safe doctor, are you a competent ophthalmologist, and how is your clinicals. There are never going to get exam, like Dr. Mahek has also told. So your methodology, when you answer any question in a FRCS exam, it has to begin from the answers have to begin from life-threatening causes to vision-threatening causes, and the last will be cosmetic. So never utter words that are that would not be in this scenario, from life-threatening to vision-threatening to cosmetic. It has to be in that order. Now, I actually got less than 2 months of time to prepare for this exam as such, because we got to know that I've been allotted at the Delhi Center around 10th of July or first week of July. And the exam was on 23rd of September. So I had only that much time. I had not started preparing beforehand or something. But I do not feel that these 2 months are the only months that actually counted. It has to be right from your basic MS preparation. It cannot be that if you haven't prepared for your MS, I feel it will be very difficult to do it in 2 months. So your basic MS preparation or your DNB preparation has to be extremely thorough for you to then, once you put the date of your exam and once you allotted a specific center, and if you start preparing then it will be a really current situation if your basic preparation has not been good preparation. Again, study resources as told by Mehak. I have similar resources, but Kansky was irrepressible. It is the gold standard. They expect you to know Kansky thoroughly. The images, as Mehak said, the same images, most of the ski stations had images picked up from the book itself. So you need to be thorough with the images that are in Kansky. I really found the book on practical viva OSCE very useful, because that book gives you answers in the format that they would expect you to answer in the exam, right? From I would like to begin examination with so and so. So it gives you how they expect you to answer. Because I did not have any study partner, because that is usually recommended that FRCS clinical exam, you should have a study partner, you should have someone to practice with. I did not know anyone in my friend group or in my peers who was given the exam. So I was all alone, and I was reading whenever I had the time to, and I was practicing during my OPD. So I did not have any of that. So that book was one book, which was a small book, but it was very helpful for me. Then there was a Muthuswamy, Professor Muthuswamy sir's university a Telegram group, which had a few discussions, and I could attend a few of them. I did not attend many of them, again, because of the time constraints. But you could mail sir your details, and he would add you to the group. And I think that group is a good group to be on, where there are constant discussions and your doubts are being solved. Again, Dr. Chua's Clinical Exam Techniques is a gold standard book. That is exactly what they expect you to do in the exam when they ask you to evaluate for ptosis or for proptosis or basic pupillary exams or extraocular movement restriction. All of those examination techniques are given in the Dr. Chua's book, which I referred to. And Dr. Chua's website was the website which I used for going through the clinical exam videos. There are multiple videos, third nerve palsy, fourth nerve palsies, then multiple pupillary exams, ptosis. All of those videos were the videos which I saw a couple of times before the exam. So those were the things that I used. Past candidate experiences, I would highly recommend, because then that gives you a judgment and that gives you an idea of how your exam is going to be. I went through previous 3-4 years of past candidate experiences, and more or less the exam was similar. It was on the same terms. There was nothing out of the box. So I would highly recommend that you go through the previous candidate experiences. And Oxford Handbook for Clinical Medicine was the book I used. Only the emergency section, only the flow charts. I did not have time to go through medicine in detail at all. So I did only the flowcharts of the emergency section, and that was good enough. I was asked a question on status epilepticus, and I could answer it well. So I feel if you do not have time, then this is what the bare minimum is. I actually did only this, and it was good enough for me. So again, how Dr. Mahek has already, I think, discussed this. I feel the exam was extremely fair. It was extremely just. It was extremely time bound. There was no place where, you know, where someone can point out a finger and say, oh, this was not good, or this was bad, or this wasn't conducted well. It was, the exam started at, I was told, the exam will start at 9:30. It will end at this much time. It ended at that time. I had no complaints with the exam conduction, with the exam, with how the examiners were. They were all extremely helpful. They would give clues if you were stuck anywhere. You have to just pick up those clues and then answer. Available hardly any time between, and before it's over. It's extreme fire, so you will not even think as if your tongue. Again, I'm not going through this in detail because Dr. Mahek has already told this. For the clinical exam, couple of minutes break in between the stations. So the clinical exam first station was ICO Ophthalmology station, which personally for me is a very difficult station, and it did not go well. It wasn't the best station. So I think even if you are not able to do well at one of your stations, I think it should be okay, because if you are able to cover up in the rest of your stations, you should be able to pass the exam. But I could do 3 cases in all the 4 stations during the clinical exam, though my neuro-ophthalmology station was not the best station, I would say. So yeah, like I said, we were told that the exam time would be from 10 to 11:23, and it was from 10 to 11:23, not a single minute extra. For OSCE, I had topics which were very common and nothing out of the box or nothing out of the blue that they had asked. These were the topics and a few questions that I was asked on each of these. I could do most of them quite well. Again, for the clinical exam, I had these cases. What I was stuck at was the case at frozen orbit. He also had later that I got to know after discussing with the others who had given the exam at the same time, was it had some abandoned innervation of the lid, of the upper lid as well, which I missed. I couldn't identify that. But others were fairly easy and straight. I could answer them. And again, in alternating exotropia, I was a little stuck whether it was exotropia or phoria, and I got stuck in basically that station. But others I could answer all of the questions fairly well. So I think it doesn't matter if one of your station doesn't go as per your expectation. I had seen many people carry a lot of instruments. I did not carry much of it. I had carried a STOT scale and a 9TD. None of it I used because everything was there at the center. So I did not bother actually opening up the box and trying to use my instrument, because you don't have that much time. You have 12 minutes, and if you want to complete the 3 patients, you barely have 4 minutes per patient. So you have to examine the patient as well as answer the question in those 4 minutes. So you do not have time. So I would say if carry minimum required items to the exam, do not carry too much. You won't have time to use that. The center usually provides everything. It was very well provided at our center. So I did not have a problem. And if you have difficulty in understanding a particular question, I would say that you can ask the examiner to repeat the question. There is no harm in doing that. If you do not know a particular question, do not be stuck at it. Say you don't know and move on to the next. Because if you're stuck at a particular station and then you're not able to go ahead with the particular case, then you lose time, and there is no time to lose in this exam. You have to do the number of patients, at least the baseline questions you have to answer for all patients. So do not stress and do not get stuck at a particular question. Just say you don't know, that is fine. And I would say when you enter the examination, the station, greet your examiners, greet your patients. Do not evade eye contact. Your confidence. Non-verbal aspect is taken into account. So please greet patients, greet your examiners. Even at the end of your station, say thank you, and then leave the station. Also, if you're examining the patient, basic courtesy and basic politeness is what they also look at. When you're asked to examine pupils, or when you're asked to examine with a fundus indirect, start with the lower illumination with your indirect, because that is, I feel that was taken into account. I started with the low illumination and then slowly turned on the light till the patient got comfortable. So these are few tips I would say that they do, I think, consider. They may not mark you for that, but I think that is considered. Then patients with compassion, you do not need to take any informed consent. Is already taken before the patients are taken for the exam. So you do not need to take a informed consent or anything, but just courteous examination should be okay. Then do not ask. My exam, my OSCE exam was on the second day of the OSCE sessions. It was the first session. Again, my clinical exam was on the fourth day, and it was the first session of the day. But between the two sessions also, they had changed the patients, they had changed the OSCE scenarios. So I feel there is no point in asking the previous batch or the previous day what questions were asked or what scenarios were kept. It will not help you. It will unnecessarily confuse you. Because for me, what had happened was when I finished my exam, and there were a couple of other fellows who were there who were discussing a CNVM case that was kept. And I did not have a CNVM case, and I was so dejected and disappointed that being a retina fellow, I missed a CNVM. Is it even possible? How can I do it? A neuro-ophthalmic station was already not up to the mark. So I was really very dejected that, I missed a CNVM in a station, in a retina station, which I felt was my strong point. And then I realized that no, they had changed only one patient in the next session. And that session, they had changed the other two patients.
So Bombay sandwich Bombay sandwich.
Of the other two patients were the same patients, whereas this one patient they had switched. So do not, I think even if someone would have asked and you would have gone with the pre-notion that is a CNVM, it might have gone wrong. So I would say do not discuss any of the cases, and OSCE, it will not help you. And yeah, stay composed. Even if your first station doesn't go well, it doesn't matter. Let others be you should give your best shot at the remaining ones. And I feel in the hindsight, I had not got as much time to prepare because I'm still doing a hectic retina fellowship. But I feel I could still make it because I had a very thorough MS preparation. There is no doubt about that. I had no doubts about that my MS preparation has been very thorough. So I could manage with minimal revisions and minimal reading. So if you're in the same situation where you are not having time, or you're doing a job and you don't have much time, but if you feel that your MS preparation is thorough and your basics are very clear, I think it is an exam that you could easily pass. It should not be a difficult exam to pass. My gratitude to my family, my teachers, my parents, and my colleagues for always standing by me and supporting me. Best wishes to those who are preparing. And if you have any queries, you can mail me and you can follow me on my Instagram channel. Thank you.
So that was, I think, we had two lovely talks, and before we go to the audience question, is what I would like to know is, so I think you both have covered this, but what is the best time you feel to go ahead? As soon as possible, as soon as you have the experience and you are eligible for the exam, and should you start from day one as soon as you enter residency?
I went through the FICO route. So FICO, I think there is I think 3 years experience. There's some kind of experience that you need before you're eligible for FRCS. So definitely, I think if you have a good basic knowledge during your post-graduation and you've done your post-graduation very well, then even if you give FRCS exam after a certain break, or while you're doing fellowship or your own subspecialty fellowship, I don't think so that would affect really, because I gave after 3 years of post-graduation. I did not start then. But I mean, I did not find as much as difficult, to give the exam even or start the preparation as well, because during the fellowship also, it's not like we saw only retina patients, or we did see general patients as well, majority retina patients, but we did see general patients as well. So that would keep you in touch with other subspecialties as well, and will help you in your FRCS exam. So I don't think so that just make sure that you have a very good post graduation, your basics are clear, and even if you give it after a certain kind of gap, you will be able to cover most of it by the books that are recommended.
Yeah, Dr. Aditi, you would like to add anything?
No, I feel the same thing, but it also depends on what your aim, why you're giving the exam. So for me, I have no plans to go abroad or to go to UK or something. If someone has those plans, then they will have to chalk it out differently. I just gave the exam because I always knew it is a good exam to give and it is a good degree to have in your CV. So for me, it didn't matter. Actually, I had actually applied for it last year as well. But because there is a lucky draw system for you to get a placement for the exam, I had not got that. So I just tried it this time, and this time I got in. So I gave it. But if someone has some specific plans that they have to go abroad or to go then they'll have to chalk it out differently, I think. And that has to be thought about more seriously. But otherwise, if you're just giving it as a good exam to give and as a good title to have in your CV, then I think it should not matter when you give it.
Okay. So I think you've answered the next question anyways. So Dr. Mehak, what was the motivation to give the exam? Like,
Motivation to give the exam, actually, I'd like to have plan Bs for my life. So ever if I think that I don't want to, work in India, I should have a kind of degree that would allow me to work somewhere else as well. And plus, these exams definitely make you smarter. The more you read and the more you give the exam, I think it's an experience that makes you a better doctor overall. While I was reading it for FRCS, there are a lot of things that I was able to recollect back, which did help me in my practice. So these exams definitely make you a smarter doctor. Plus, it always looks nice on the nameplate. So I think, yeah, that's the motivation here.
Yeah, there are a number of things that you go back again and you read and you feel, oh, now this clicks better. So I feel that is also a good thing. And to be a comprehensive ophthalmologist, I think this is a really good exam to give.
Yeah.
okay. Will you say that because you were doing retina fellowship, it was a little bit easier, as generally what we see is people are scared of two things. One is neuro-opthal and orbit, and the other is the indirect. So, and you can practice at least neuro-opthal by seeing videos, but someone who is not comfortable with an indirect, do you feel that that was an advantage, like when you discuss with your colleagues and this, or it just doesn't make any difference?
I don't think so, because that is definitely not the major part of it. But yes, I mean, indirect should everyone should be able to do indirect examination. Even during PG, we used to do a lot of indirect examination, and that continued towards the fellowship, of course. But I don't think so per se. Retina station is the most difficult one. I think even now we think that squint, everyone is more afraid rather than retina. Even those who are not retina specialists, they also say that the squint is something that they all scared of, and you do get a squint case. So the one I also got an alternating exotropia with a DVD. So, but since I had examined so many patients during my PG, squint specifically, and we had a particular protocol to follow, so I think that really helped me. So it all depends. I think being a good general ophthalmologist, knowing your basics, knowing the procedures that you need to do, like indirect squint examination, pupillary examination, just being a safe ophthalmologist doesn't matter whether you are done your subspecialty in retina or anything else. I don't think so that matters.
They expect very little, like they do not expect you to, depress the periphery and find some hole or something in the periphery. They do not expect you to do all of that. So even if you have a basic IDO skill of examining the posterior pole and slightly mid periphery, I think that should be good enough. They don't expect you to do intense retina examination. So I think that should not be a hurdle for most.
Yes, true, that's true.
Okay, so I think Dr. Rakhi has joined, but I think she's driving. That's what seems. So let's not disturb her. Or Rakhi, are you there? So other thing is, so both of you had Delhi as your center?
Yeah.
Yes, sir.
So do you feel that the center makes a difference? Did you have that you wanted this center, and what did you try going abroad? Was that also an option?
So for me, this is the first time that I applied and had gotten it. I did not apply abroad. I applied in India as well because the facilities are there in India right now. So definitely I wouldn't want to spend the extra money. So yes, I am not sure about this, whether abroad and it makes difference, but definitely, I mean, but we had international, so the examiners are going to be from India as well as abroad. So there were doctors who were not Indians, and they ask you questions. They see your examination, the steps that's examining, how are you examining, and everything. In fact, the neuro-ophthalmology, one of them was not from India, and I think one or two other than that. So, so yes, they definitely have a very thorough examination, and they look at you in a way that they feel that you should be safe working outside, not the but I feel like Indian doctors are as smart and more smarter, I think, than them. So yes, definitely, yeah.
I had also not applied. Actually, the last time when I had applied, I had just ticked Delhi and Mumbai as the centers because those were available during that diet. The same thing I did this time as well. And I was allotted Delhi and I had no problems. So I don't know whether if center makes any difference. I am not sure.
Oh. And what is the rough cost that you have to pay for the Part 3 exam currently?
1,80,000, I think.
Yeah, 1,80,000. It was around 1,780 pounds or something.
Okay.
So
So when you
a very big motivator to
Yeah,
ensure you
that is, yeah, in
really
fact, that is
pass
the
and don't just look on.
that's what I tell everyone, that you pay the fees and then everything will happen, especially for part 1 and part 2. They're like, okay, the preparation is not yet done, so maybe next time. And so that's what I tell. Once you pay the fees,
Never enough time.
yes.
Whatever time you have to make the
But
most.
that is the biggest motivator. I think once
Yes,
you
yes,
pay the fees,
definitely.
there's no looking back. You have.
Definitely. Fees is actually the biggest motivator. I was not ready to pay it again, ever.
Okay. So you both went through ICO. So when you go through ICO, so do you go directly to part 3, or how is it?
So FICO, you would give the part 1 that has refraction and basic science. They're two separate exams, but that is considered as part 1. The part 2 is FICO clinical. After you've given your FICO clinical, passed your FICO clinical, you can directly go to FRCS Glasgow part 3. So they had a collaboration with Edinburgh before, but now they don't have it. Now they have it with Glasgow. So after clinical, you can definitely go for FRCS Part 3 Glasgow and also give your FICO advance to get the degree of FICO as well. I think FICO is much. I'm not given FRCS Part 1 and Part 2, but from what I've heard, FICO is a much easier exam. There are a lot of centers. Plus, the first and second part is basically basics and clinicals, which are almost the same. So the first and second part of FRCS is exempted because you've given FICO. So I think that is something that we can all use, to get the FRCS degree. So I think that's a very good route.
Only
Okay.
thing I think there is a slight difference in terms of those who have gone through the FRCS route. They have a written medicine exam, like medicine questions that they have to answer in the part 2 of FRCS. So maybe if you've gone through that, then maybe the part 3 of FRCS medicine becomes a little easier because you have gone through it just before for the part 2. But other than that, I think the ICO route is the much easier one. Because medicine, you're completely out of touch. When you're trying to read, you can't make head or tail of it. So you have to literally just remember the flowcharts and go for the exam. That is what I had done for the FRCS Part 3.
So in the hindsight, you are saying you should have a good background of ophthalmology in your residency, and even your MBBS graduation also should be good to.
Good enough. That's the emergency part, I would say.
So I think Dr. Raki has joined. Hi Raki.
Hi,
So
hi.
so how was your journey? Did you go through ICO or
I went through the ICO route. Actually, ICO route is much easier.
I think that is the most popular route, at least what we are seeing in India, that people like it. So you have also FRCS Glasgow.
Yeah.
Okay. So is there any difference or any advantage between FRCS Glasgow or FRCS Edinburgh? Or is there any difference in the pattern which you have known? Or because you had gone through ICO, you knew that you want to go for Glasgow?
Actually, by that time, that collaboration between Edinburgh was already closed. So only the Glasgow route was open. So we don't have much idea about what it is like to write the Edinburgh exam.
But for those who want to study abroad, I think FRCS Glasgow or Edinburgh is the same. Because anyways, if you want to go abroad, GMC registration you can get through FRCS Glasgow as well. That's for sure. So, yeah.
Okay. In fact, GMC registration you can get even without FRCS. Okay. Generally, what they want is if you want to practice there, then they want FRC Opt.
Yes.
So, but yes, but you can this, but your pay scale and your progress would be lower if you are not FRC Opt. You can definitely practice even with FRCS. Because a lot of people go directly after ICO and sometimes they also get GMC registration. So that has not much got to do with FRCS. So Raki, would you like to add anything, any tips for
So regarding the center, they were discussing, and this thing I have told in my last talk also. Some centers does make a difference. What I have heard is like Delhi centers are much tougher than the Bangalore center. The pass percentage is usually, I have heard it from many people from north itself and even from south everywhere. The exam that happens in NN, the cases that I keep is somewhat very common, something what we expect always, and they do have all sort of cases, like ptosis, skin, everything will be. It will not be so difficult ones. They'll not be keeping some an ophthalmic socket and such things. It will be all straightforward. So you'll be expecting such things and you'll be already prepared for that. And they have a wide variety of cases also, and the pass percentage usually high when it comes to the Bangalore centers. So that's what everybody told. So during my time, I was specifically opting only for the Bangalore center.
So we need to congratulate Mehak and Aditi again. Okay, so that is one point if somebody wants to consider maybe, but we've seen that sometimes you don't get the op because it's as a lucky draw. So I think whatever center we get should go ahead with it. And anyone in the audience wants to ask anything, because I think the discussion has been extensive. If anyone wants to ask anything, can please use the mic and go ahead. Yeah, one more thing. Okay, yeah, please go ahead. You can just introduce yourself and
I'm Yasmin from Egypt. I'm asking, is the number of the people applying, they having limit for exam? I think last time in Bangalore it was 80, not 40. So it's is this good point that if the number is much bigger than the other centers? I think in New Delhi and in Bombay the number is only 40.
Delhi,
And in
Yeah, in Bangalore last time it was 80. It was 80 and the pass percentage was also high.
That's mean it's a good point if the number is a big number.
Yeah, maybe.
yeah, but the passing we are talking about the passing percent, so it may not make a difference. But yes, this is a very interesting point. Maybe we should think about it, why that is there, and whether it
is there like two different sets of examiners for the 80 or the same set of examiners for 80? That I'm not sure for Bangalore.
Bangalore, I think it was the same set we had actually on different days. One set will be going on one day, the second set will be having the same examiners on the second day. Usually there will be 1 day gap, right?
Yes, but all 80 on the 2 days divided, or is it?
But we had a
more
lot of examiners actually. It was like the examiners which I got for my viva session, most of them were not there for my practical session.
I think they have
So I
lot
think
more
they'll be
examiners.
having, yeah. But
Double
we
days.
had, so many examiners were there. Few of them were common, but still so many were new when it came to the practical.
I think we had the same set of
We had the same
examiners.
set of examiners
Yeah.
that were there for the viva or ski 2 days,
Yeah.
the next same set for the next 2 days.
Yeah.
So I think it should not really matter. I don't know, but yeah.
okay. So I think that the question is,
Hello.
yeah, please go ahead. Yeah.
Hello, good evening, sir. So I'm Dr. Aditi. I'm a first year postgraduate student. So I have a question for Dr. Aditi Joshi, ma'am.
Yes, yes.
Ma'am, you said that since I'm a postgraduate student, you pressed on the fact that if your MS or DNB preparation is thorough and it is you're thorough with the basics, it won't be that tough for you. Since I am in my postgraduate period right now, I just wanted you to if you could please touch on the points like what we should be thorough with and how we should be going about the post graduation period, so that if I'm planning to appear for my FICO part A and B in coming April, and I plan to go towards the FRCS pathway through FICO only. So could you just at least touch on the points that I should be thorough with,
Yes.
in a nutshell?
So for FICO, I had read this thing. I've forgotten the names actually. Anatomy from, if I think Mehak, if you do you remember?
The basics and the refraction.
Elkington for optics.
Yeah,
Yes.
Forest and
Paris for
John Paris is for, yes.
John
Paris
Ferris and
for
Forest.
anatomy. Like through and through, I must have read them like 10 times. I knew like through and through. I had done actually, ours was a very bad batch of COVID. So I was actually in a lot of depression that we were not getting OTs and we were doing
Yes.
COVID duties. So the only thing in the back of the mind was that I should not lack in academics. Now, if I'm lacking in surgical chances and surgical skills, I should not lack in academics. So I had given my 200% for academics. I had read all possible books that were there, right?
Okay.
From Leo to Kansky to what was that? Zia Chaudhary to
Yes,
everything,
ma'am.
all
Yeah.
topics from all books. And in the end, I had actually consolidated all the topics and the different points that I had felt was something was not there in some book or something. I had
Okay.
used an iPad Notability app, and you can just cut paste different topics and you can add. So I had a compilation of each topic from different books.
Okay.
Because that is because I had a lot of time and we were not having OTs and we were having only COVID duties. So maybe that may not be possible in a hectic residency.
Yeah. Yes,
But
ma'am.
yeah, so I had done all of that in terms of MS preparation. Maybe you could do that if you have the time.
Okay.
I'll just add one point. The International Men's Day just passed yesterday. So had we done the session on that day, and we would have a little more representation from the boys' side, maybe this preparation would have been little slightly different. But that is amazing from Aditi to Aditi, because it was specific. He wanted only Aditi.
Yeah.
So I think
Thank you, ma'am.
he has answered pretty well. So yes, you have to take it this, and your goal should be primarily to clear your degree and with the best way possible. And these
Yeah.
exams will definitely help you. They'll be milestones. So you should plan it as early as possible. And I don't know whether now you can, from FRCS you can go to FICO, because when I did, I didn't want to study optics separately. I think that is there in ICO, but FRCS it's very less. So I did FRCS part 1 and then I did FICO part 2.
Oh.
So that is just, I thought ki maybe I'll save something. Okay, and I didn't want to have a separate paper on optics. So if that is also true, you can go ahead with that. And best is to, as we were discussing earlier, to whenever you get this opportunity, pay the fees.
Yes.
Pay the fees, and with ICO, what I tell residents, ki it's a paid exam. If for some reason, if you are actually, for genuinely you are not able to give the exam, you can actually postpone. Okay, you can mail them and they will postpone the exam. So you don't need to worry that you will be wasting so much money because you were not able to give the exam for some genuine reason. Because I know my friends who have postponed the exam for even 2 sessions, and definitely not for any genuine reason, but ki chalo next time. So if you pay the fees, that would be the best motivation, and you will start preparing for it.
Yeah.
Anyone else?
So I just have one question. I'm so sorry.
No, no, please go
So
ahead.
I wanted to ask that FICO part A and B on their site, they are mentioning that it's not preferable to give it together. So I just wanted to ask, should I give it separately or should I appear for A and part A and B together? Like what is more, like what is better in your experience, ma'am?
The
I
part.
had yeah.
No, go ahead, go ahead.
I had given both of them together, the first optics and the visual sciences, then the clinical and then the advanced. I think most of the people I know have done the same thing, because then unnecessarily you're increasing the sessions that
Step,
you'll be giving,
right. Yes, ma'am.
steps you'll be
Yeah.
giving. And the visual sciences and optics is very doable. I don't think it should be that
Okay.
difficult.
Okay. Got
I
it, ma'am.
did the same.
You just
So
have to read that Elkington book
yeah.
and Chua MCQs for
Yeah,
the
yeah.
should be doable. Yeah.
Okay, ma'am. Okay. Thank you so much, ma'am.
Yeah.
Yeah, one more question. Did you all go for any of these sessions where they actually train you, like sort of they have these 2-day sessions, 3-day sessions?
I think there is one at Lakshmi Eye Hospital,
Yes,
Yes, yes.
Panvel, but no, it was on 30th of August, and our exam was on 23rd September, and I just got to know like one day before, and I didn't have leave to fly
Right.
back from Chennai to Mumbai and all of that. So I did not go for any of it.
Same here. I have not gone for any of these sessions.
Not gone.
Okay. Yeah. So anyone else? Because then we let them relax. And if anyone has any questions, can please take the mic.
Yes, good evening. This is Dr. Faiza speaking. I'm currently doing my phaco-refractive fellowship, and I have actually given ICO part A, B, and C. A and B I gave separately, and I felt that they could have been given at the same time also because they were more or less straightforward, and there was a lot of repeated questions from the previous papers also, especially in the optics exam that I had given. Part C, unfortunately, when I had given the exam, it was even, I felt the format of the questions that we had received was very different to all the past papers that I had seen. So unfortunately, I was not able to clear that. So are there any recommendations? Did anyone feel that the recent exams have been different from the previous exams, or indications as to how to go about preparing for the MCQ portion, especially for clinical ophthalmology, ICO clinical?
So FICO clinical, I think again, Kansky is very, very important. I think the clinical part of it, definitely, I mean, you cannot miss Kansky for FICO clinical at least. Plus, I think I'm not sure, I don't know about the change of pattern or change of the kind of questions that they had, because we gave like 3 years back. So, I mean, I gave 3 years back. Yeah, so we don't know about it. But I think I did Kansky, and I think I was able to pass it in one go, which was more than enough. I didn't even see so last year questions. Still, I gave the advanced. The FISO last questions was giving my advanced ICO. So before that, I didn't even see the previous year, but I think I was thorough with Kansky. So, but I'm not aware of what you were talking about, unfortunately.
Yeah, the whole MCQ book of Massachusetts.
Yeah.
For I think clinical and advanced, I had read Kansky and solved those MCQs. So, but I don't know what is the current scenario of FICO.
Thank you.
Yeah, I think the provision and academy also people like to read for the MC.
Yes, provision.
So,
But I heard recently are less, very less. Few of our juniors were like telling it's really difficult to pass now, especially the clinical as well as the advanced part. During our times, there were a lot of repeat questions.
Yeah.
Now we are very strict with the question paper leaking, so we are not able to get the past question papers also. And I heard there are very less, sometimes like no repeats at all.
Oh.
Okay. So
I'm sorry.
yeah,
I'm just going to follow up on that previous question. Because I had given my exam in the last 1.5 years. So the A and B, when I had given, it was very simple. But even a lot of people that gave the exam with me in the last year found it very difficult, and many people didn't pass, unfortunately. So some people were suggesting that it is better to go ahead with FRCS. The ICO has become harder than FRCS. So any thoughts on that?
In our like the Telegram channels where we used to get the previous question papers and where they used to hints on how to go about the exams and all. Now you can't find anything. That's what I heard. And and they are being very strict and banning people who are teachers and all those things. So it is sort of difficult, I heard. I'm sure.
And
Hello, good evening, ma'am.
looking about age limit, I think we had a question on age limit.
I don't think there's
There's
any
no
age limit
age,
for
but
that.
I've known people who are 50 plus who have
Okay.
also given the FRCS exam.
Hello, good evening, sir. Anush sir, good evening, sir.
Yes, Dr. Anand, please.
So, good evening, madam. Aditi madam, good evening. Raki madam, good evening. But I saw there is age limit in ICO website.
Okay. If it's there on the
For
website.
around 30-40 years, madam. Is
I'm
that
not
true?
sure about
In
FRCS.
yeah, ma'am. That's why I'm
Which part
asking.
of FICU? Yeah.
Part 1, ma'am. Part 1. For ICO, for FRCS is in age limit with FRCS or both are.
Sure about ICO, but FRCS.
We're saying third
Okay.
part. So, well, I think the basic science FICU, if it's mentioned on the website, then there might be an age limit for
Working at a high volume center, I'm currently third year PG. And over here, mostly the examination is not done in step-by-step manner. It is mostly based on the experience that the consultant have. So, ma'am, what we are lacking that I have seen is a approach towards a patient. So, ma'am, can you please give me some tools or like books or any YouTube channels or something like which will help me in building up the preferred practice patterns?
So, definitely during your PG, if you want to have a certain protocol while you're examining the patient, it's very important for you to know your differentials, first of all. So you have to be thorough with your postgraduate books, that is Kansky, and certain other books, and you have to be okay. You have to know your own differentials to all the to your main diseases, and then you have to rule out those differentials by following a certain protocol. And there are a lot of books also. I think there are a lot of ophthalmology clinical exam books that are. I think Namrata ma'am has one. I'm not sure. There's one practical clinical exam book by Namrata ma'am, and that is also has given a lot of in detail stepwise manner as to how to approach patients. If anybody can give
You
certain,
could present cases to your faculty, and during that time, maybe that could help.
yeah.
You may not do the methodical examination for every patient in the entire OPD. That may not be possible because everywhere there's, a large volume and you want to try to finish as much as possible. But maybe once a week or twice a week, if you start presenting the cases, at that time you do a thorough examination. If you do it every week for 3 years, I think that should be good enough.
Yeah, so that is a very important point, that you cannot try to become a master in these techniques in your OPD, because then that will create a friction in your learning and with the flow of the system. The best time, as they used to say, is you learn in the wards. So it is when you have free time and you have the patient who is admitted, so you do a gonioscopy, That time you can dim the light. It may not be possible in the OPD that every time you are doing this, but you are gaining experience. So generally what was told to us is that the glaucoma patient who's admitted for trap, you are not supposed to do gonioscopy because you don't want any.
You don't know.
Yes, but you do it gonioscopy on the other eye. So generally the angles are in most of the cases are bilateral symmetrical, and these patients are admitted in medical colleges for a day or two. So you have time, and
Sure.
so what we used to do is we used to open the OPD, go there for a slit lamp. So you learn it that way, and the case discussions are the where, because in your OPD paper you will not be writing 10 DDs. There may not be place for that. When you are presenting, so you learn about it, and there are things that you know what is the right technique. And even your consultants, and they will know what is to be done, but in the OPD they may not go in that same order. They know that it is a case of this, so they may not list out all the DDs, but that is how you pick up, and you will learn.
Also, sir, I feel like may not be possible for all if there are some financial constraints or something. I feel right from the first year of first year of your PG, you should have your own indirect, you should have your own gonio, you should have your own 90D, your own direct ophthalmoscope. Because when you have it yourself, there is no stopping you that you don't get to examine something because you don't have it. So if you are able to manage and you're able to buy all these things, like I had bought them from the first year and I was doing IDO for all the ward patients right from the first year. So even if our ward didn't have a indirect, and when you have to go for ward calls, we used to take direct initially for the first few months. But then I realized that was restricting my own learning. So then I bought my own indirect and I started doing. So by the end of, I would say by the end of second year or start of beginning of second year, I was good enough to do a basic IDO myself. So there are many people who I meet right now who say, oh, but our department had only one IDO or only one gonioscope, and then only the consultants used to use them or whatever. So then you are not going to learn. So if you're able to buy it and you're able to save some money and buy it as early as possible, I think you should buy it. And I think there are many people who gave excuses that, you will lose it during your residency, or, someone else will take it, or the seniors will take it. I think that is a little excuse to give. Yeah, I had a 90D and a 20D with my own name engraved on it, so no one took it, and I was very fortunate to have good seniors who didn't bully me into giving the instruments for their personal use. But if everyone buys it, so all my course also bought it. So there was no one, who was asking for my instruments or something like that. So all of us by the end of second year were very good in all these basic things, despite our department being a government medical college having only one gonio and one IDO. So I think if you should have that as a priority.
That's fine.
Hello. Ma'am, I had a question. Like, at what point did you refer to those American Academy of Ophthalmology books, or is it like necessary to use them, especially for like Part C? Could you just tell me about that?
No, not for any of these exams. I did not have time for either for ICO or for FRCS. That was during when I was reading a book, a topic or a chapter. I would refer to that simultaneously. But none of these exams really require that much depth of.
True, even I didn't read those books
Yeah.
myself. So yeah.
Okay. Thank you.
But say if you're doing a corneal ulcer or a retinal detachment or some specific topic, you can go through 2-3 other books and see what extra, if they have given something that needs to be added in your like base book, which could be Kansky or which could be anything else. But try to consolidate everything in one base book, so that at the end of 3 years, just before your preparation leave, you have everything ready and you know that you have to read this topic from this book and it will be done.
Okay, got it, ma'am. Thank you.
Okay, if there are no more questions, then we'll just end the session here. And if anyone has any further questions and so then we'll share email address of Dr. Aditi, Dr. Aki, and Dr. Mehak, and you can get in touch with them. And it has been really nice and really that they have spared their time and talking in depth about the preparation because generally it is straight from the horse's mouth, and so really great points, and thank you for this amazing session, and hope we'll catch up again. So thanks and good night.
Thank you. Good night. Thank you.
Good night.
All the best to everyone who's appeared.
Yes, all the best.